Good morning, everybody. It's a really pleasure and an honor to have with us today Professor Francesca Rubolotta, Iwin's president and founder and director of intensive care at the McGill University, and Olfa Hamzaoui, a full professor of intensive care at the Robert Debré Hospital in Reims, France. The third edition of Iwin's has just ended in Catania. It was a great success. We covered important topics as gender gap and as gender medicine and many others. This is the second interview with Olfa Hamzaoui for our YouTube channel. For us, Olfa is a really important role model. So let me begin the interview. Olfa, the age index is less favorable for women compared to men. What do you recommend to improve it? Thanks.
Oh, thank you, Sophia, for this nice introduction. I want to thank also Francesca for the 2 days Iwin meeting, which was really a great success and a great opportunity to have such a networking, and of course I think you are asking me something which is very relevant and very important in the academic career for women, because as we know now, it is documented that women in medicine have significantly lower H index than men. Either they are assistant, associate, or full professors. And this is really in all medical specialties. And the absolute difference in the H index widened with ascending academic rank within these categories. Actually, we need probably, first of all, to precise the H index. What is it? The H index is calculated using the number of times one's publication are cited in the literature. And it is one measure of course, their impact, the impact of the publication. So an individual's number of citations, and therefore H index, increase with the number of publication and time since publication. So this is the first thing important to clarify for all the audience. The second point is that there are some factors that contribute to such sex disparities, is that there is a slower rate of increase of H index for women compared with men during career. And this is because, of course, as you know, first of all, there are gender-based disparities among authors of scientific publications. And this is really widely documented and are, of course, particularly prevalent at the earlier career stages. And this, of course, will impact the opportunity for women to start accruing citation, and so slower increase of H index. In addition, of course, citation numbers for individual manuscripts are influenced by factors such as the scope of the journal, the readership, number of co-authors, authors' reputation, fundings, and all these factors include also author-related factors such as rank, reputation, national and international collaborations, and network. And we know now that disparities exist for women in medicine, in research funding, as well as high visibility opportunities such as medical society awards, plenary speaking roles, invited authorships on perspective pieces, and leadership roles. So these honors position individuals as experts in their field, and of course will influence the reach of their scholarly work, and also including, of course, the citation rates, and so impact negatively the H index. I think that in the promotion process, it is very important to consider a holistic measure of success beyond publications and their impact. such as, for example, and women are very strong in this, breadth and depth of mentorship, educational initiatives, and leadership roles. So a path with historically lower research productivity, where there is greater contributions are made in other domains, need to be considered, and not only the H index and the publication citations. So the question that leaders, I think, in my opinion, and institutions need to ask is why women are represented to a lesser degree on research tracks, and what institutional and departmental initiative can be undertaken to correct these disparities. And so we need to put in place programs and policies that will support women in research careers and overlap significantly with initiative, those that will seek to correct these H index disparities. These are by the two proposals that I can give and that I can say for the H index.
Thank you so much. And what do you think about the, gender medicine? How important is to take care of it? Thank you.
Sophia, this is also an important issue. We are in the era of individualized and personalized research. So how can we do this without taking into account the gender? Sex and gender interact in a complex ways to affect health outcomes. You know that sex can affect, so the gender can affect disease risk, progression and outcomes through genetics, because there are some that are related to the X and Y chromosomes, cellular and physiological, including hormonal pathways. So these pathways can produce differences in susceptibility to disease over the life course. And for example, data showed that men experience more severe COVID-19 outcomes in terms of hospitalization and death than women. This is in part explained by higher quantities of angiotensin-converting enzyme found in men, which binds to the SARS-CoV-2. So gender norms, socialization, roles, differentials in power relations, and in access to and control over resources contribute, of course, to this difference in vulnerabilities and susceptibilities to illness. So how illness is experienced that such as health behaviors, including health seeking, access to and uptake, of course, the health services, treatment response, and health outcomes. And what data shows also that men increased risk of acquiring SARS-CoV-2 is also linked to their lower rates of hand washing, higher rates of smoking and alcohol misuse, and related to higher comorbidities for severe COVID-19 symptoms as compared to women. So this is important to consider when you are treating patients and when you are including patients in cohorts. So another scope, and I will finish with this, which is probably a problem which is so far from our European vision, but I think it is important because gender has also implication for health across the course of every person's life. And what we know from in some societies that there are gender inequality disproportionately affects women and girls. There are some society they have lower status and have less control over decision making about their bodies, in their intimate relationships, families and communities, exposing them to violence, coercion, and harmful practices. So women and girls in this society will face higher risk of unintended pregnancies, sexually transmitted infections, including HIV, cervical cancer, malnutrition, and depression, among others. So, you know, it is important to consider this gender medicine when you are making such a clinical research in our practice.
Thank you so much. How can we promote role models in the leading position?
Yes, Sophia, it's also another issue different from the second one, but it is also an important, I think it is our roles, all of us, like Francesca, not only me and other really great women that I met in Sicily last week. And what we know for role models, according to the psychologist Albert Bandura's social learning theory, people develop by observing others' behaviors and copying them. So if you demonstrate strong qualities like integrity, honesty, openness, you will encourage, of course, the people and the members to behave in a similar way. And of course, if you are with a bad practice, the people also can likely to develop bad behaviors. So people naturally look up to them, look up to the role models, seek to do their best for them and copy their behaviors. So role models will have this role to encourage, to inspire others to be at their best. So our roles is to try to be the best role models as we can in our community, and for especially I'm talking about women in intensive care. How can we promote this? Of course, we can promote this by making these role models visible, by trying to interview them and try to learn from their life pathway, their careers, and how they achieve the goals of leadership, academic position, or a key position. Anyway, these are some ideas to try to promote the role models in our community.
Thank you so much. Francesca, do you want to add something?
No, I wish just to thank Olfa for all those important comments, and I look forward to continue working together during the year to promote those initiatives, and maybe to look a little bit more in depth to the meaning of H index for women as we suggested. So we will be in touch, and more to come before Iwin 2024. Thank you, Olfa.
Thank you, Francesca. And thank you
so much. Thank you.
Thank you. Bye.
Bye.
Thank you.